Good afternoon, everyone. I'm just going to take another minute or two for a few more folks to filter in, and we will get started promptly. Thank you for your time and patience. All right, everyone. Can I get a thumbs up from someone in the audience just to make sure you can see the title page of the slides? Perfect. Thank you so much. All right, everyone. Well, thank you for joining us today. This meeting is recorded for any of our colleagues who are unable to attend. And my name is Michael Webb. I am the program manager of the Youth and School Communities program here at Pima County Health Department. We have a slate of programmatic experts from our EPI team and our public health emergency preparedness team who are here today to share updates of the new consolidated guidance from the CDC for preventing the spread of infections in K through 12 schools. So I'm going to go ahead and start moving us through the slides. The way that this is going to work is as we pass from one subject matter expert to the next, feel free to introduce the next division when it's their turn. So first up, we have our EPI division. So I'm going to turn it over to our EPI team.
Hello and welcome, everyone. My name is Lindsay Kohler, and I'm the Epidemiology Division Manager at Pima County Health Department. And I just want to really reiterate, the importance of our conversation today, how it's not really updated guidance, but it's new guidance. They've consolidated some old guidance that was for adults, and that might have been for respiratory. And we're really trying to, the CDC really tried to simplify these previous recommendations and make them specific for K through 12 school settings. So it's based on scientific studies that show what works best to prevent the spread of many common respiratory as well as stomach infections. So we're going to kind of go through today some everyday actions that schools can take to prevent and control the spread of respiratory and stomach viruses like flu and norovirus, but also things like strep throat. And these are really designed to maximize school attendance and its benefits for all students while also preventing the spread of infectious diseases. So it's taking a bunch of scientific work that have been done and lessons learned from the pandemic and other types of outbreaks and putting it into actionable steps for schools that they can follow to keep not only the kids, but teachers and school staff safe. Next slide. So here's our agenda for today. We're going to go through the guidance step by step and also give some information at the end on how to contact the health department through the schools or through epidemiology. And I'm going to hand it over to one of our epidemiologists, Jake, to kind of walk us through the guidance.
Hello, everyone. Good afternoon. My name is Jake Alexander, and I'm the outbreak epidemiologist at the Pima County Health Department Epidemiology Department. So just a brief overview of some of the things that we're going to be talking about. On this first slide, we have guidance for preventing the spread of infections in K-12 schools. So very briefly, some everyday actions that you can take are teaching and reinforcing proper hand washing and respiratory etiquette, taking steps for cleaner air by improving ventilation in schools, consider ventilation enhancements and design when undergoing remodeling as well. Cleaning, sanitizing, and disinfecting when appropriate, and promoting vaccinations for both staff and students. Next, we have ways to slow the spread of infections once they've already shown up in the community. These include having staff and students staying home when they are sick, when applicable, using PPE or personal protective equipment for school staff who are caring for sick children, and again, reiterating, hand washing, respiratory etiquette, cleaning, sanitizing, and disinfecting are going to always be incredibly important. Next slide, please. So let's go a little bit deeper into some of these everyday actions. So as I said previously, some of the big ones that you can find are taking steps for cleaner air, cleaning, sanitizing, and disinfecting, encouraging hand washing, respiratory etiquette, and vaccinations. If you want to read more about this, you can also click the link that's at the bottom of the slide. There is some more information provided by the CDC for each of these different topics. And next slide, please. So, taking steps for cleaner air. So there's a couple of different things that you can do. The first would be ensuring that your HVAC or heating, ventilation, and air conditioning systems are providing at the minimum ventilation in accordance with design codes. Opening windows when doing so does not create a safety hazard to increase ventilation. Obviously, being in Arizona in the summer, this is going to be somewhat difficult sometimes, but consider at least early in the morning, or if you have not direct sunlight and you're able to get some air moving in and out of the classrooms. Use portable air cleaners in spaces that have poor ventilation. You can also see the CDC's Ventilation in Buildings webpage for further information on how to improve ventilation in a school. And you can also refer to the EPA's Clean Air in Buildings Challenge for other practical steps to optimize indoor air quality. Some of these include, as I said, just enhancing existing air filtration and cleaning, ensure that filters are being routinely changed, and then get community feedback. Ask the staff that work at your school, employees, but also parents and contract workers, and put feedback mechanisms into place. Create a survey, ask people for their feedback, because the people who are being served are going to oftentimes have good ideas on how things can be improved. Next slide, please. Next, we have cleaning, sanitizing, and disinfecting. And you're going to hear me talking about these three things a lot over the course of the PowerPoint, because they are incredibly, incredibly important. So first off, you should be disinfecting surfaces daily using an EPA-approved product, and you can see a list of them by clicking that link, that eliminate target pathogens even in the absence of known illness cases. Some of the best ways to prevent the spread of illness is to prevent the illness from starting in the first place. And by performing daily disinfection, you're going to be able to help mitigate the spread from the ground up. These disinfecting surfaces the disinfection should focus on high contact surfaces such as doorknobs and counters, keyboards, faucets, toys, if we're talking about some of the younger children in daycares, etc. And also places like in the lunchroom, any place where kids are going to be eating, you're going to want to make sure that you're cleaning and disinfecting afterwards. Additionally, it's incredibly important to clean surfaces promptly after contact with bodily fluids, and that's any bodily fluid. And you can also click that link at the bottom to follow the EPA's guidance on managing flu in schools, because there's a lot of good tips specific to flu that you can find there. And again, one of the better ways that you're going to be able to prevent outbreaks and the spread of flu and other respiratory diseases is by cleaning, sanitizing, and disinfecting. Next slide, please. Thank you. Next, we have hand washing and respiratory etiquette. So the link that is in that first bullet point shows proper hand washing technique as stated by the CDC. Proper hand washing is incredibly important. Warm water, soap, make sure that they're spending a decent amount of time actually lathering up and making sure kids are drying their hands afterwards. Also encourage covering coughs and sneezes. This is what we mean by respiratory etiquette. And ensure that your schools are providing adequate hand washing supplies. So again, soap, water, paper towels. In the event that soap and water are not available, hand sanitizer containing at least 60% alcohol can be provided and be effective. This will also be the case if you're in any sort of place that's outside the school, like say you go on a field trip. Maybe the kids are let's just say at a petting zoo. I don't know. If for some reason there was no access to a hand washing station, which there should be, hand sanitizer is still an effective measure that you can take. Next slide, please. And then finally, we have vaccinations. So staying up to date on vaccinations is going to be absolutely crucial to minimize the risk of severe disease and outbreaks. You can explore the comprehensive immunization services in your area by visiting the link in the second bullet, which leads to the Pima County immunizations page. And you also want to make sure that students are following the state vaccination requirements. And the link of state requirements are going to be listed in that third bullet as well. Something else that you can do to encourage appropriate vaccination level is to host on-site vaccination clinics. You can also connect children and or their families to off-site vaccination locations. And you can click that link at the very bottom to see a list of Pima County clinics and contact them to speak to a public health nurse to set up an immunization clinic at your school. Next slide. Perfect. So again, a lot of this is going to be about slowing the spread of infection. However, the approach that you take is oftentimes going to change based on the nature of the illness. So many strategies that you're going to want to employ when trying to slow the spread of any sort of infection is staying home when you're sick, knowing when to return to school, and using personal protective equipment or PPE for staff that are caring for sick children. The link that's in the third bullet point, the infectious disease flip chart, is a really, really great resource that provides a good amount of snapshot information for all sorts of reportable and non-reportable diseases that are in Arizona. And I definitely recommend taking a look at it. It's incredibly helpful. Next slide, please. Oh, we missed one. Perfect. So let's start by talking about staying home when sick. So we want to make sure that we're staying home when we're sick whenever a child has a fever, including a fever with a new rash. Whenever a student has been vomiting more than twice in the preceding 24 hours, or if an individual has diarrhea that includes any of these three following factors. So diarrhea that causes accidents. So this is going to be mostly uncontrolled. Diarrhea that's bloody, or diarrhea that results in greater than 2 bowel movements above what the child normally experiences in a 24-hour period. So we're talking, elevated bowel movements. Next, we have skin sores that are draining fluid onto uncovered parts of the body and that are unable to be covered with a bandage. And then finally, we have respiratory virus symptoms that are worsening or not improving, and would not be better explained by another cause, such as seasonal allergies. And for all of these, you're going to want to be having the child or their family connect with a healthcare provider just to give additional guidance on the matter. So we talked about when to stay home. The next logical follow-up is going to be when can they return to school. So for any child that's experiencing a fever, they need to be fever-free without fever-reducing medication for at least 24 hours. Additionally, if a child has a fever with a new rash, they should be evaluated by a healthcare provider. And again, to be consistent with the previous bullet, the fever has resolved as well. And this is without fever-reducing medication. For sores that are on the body, uncovered sores need to be crusted, and the child is under treatment from a provider. For vomiting, the child needs to be able to hold down food or liquids in the morning and have the vomiting resolve the previous night. For diarrhea, it needs to have improved and they're no longer having accidents or the uncontrolled bouts. If a child is having bloody diarrhea, they should be evaluated by a healthcare provider prior to their return. And then for respiratory virus symptoms, we just want them to be getting better overall for at least 24 hours prior. Next slide, please. So this is just a brief snapshot for what to do when you are faced with potential respiratory illness. So we have our core prevention strategies, and these are going to include immunizations, good hygiene, taking steps for cleaner air, treatment, which you'll get from a healthcare provider, and then staying home to prevent spread. Some additional prevention strategies include masking, distancing, and testing. It is important to stay home and away from others until your symptoms are getting better and you are fever-free without medication. Importantly, you want to be taking added precautions for the next 5 days as well. So while you may be fever-free, take steps to maybe distance yourself, be cognizant of those around you, wash your hands, all sorts of stuff like that. Next slide. So this slide here gives 4 different examples for approaching the new CDC respiratory guidelines. So I'll walk through each of the 4 examples. In the first example, we have an individual with fever and symptoms. So as you can see, that little teal part of the graph is the duration varying. So that's essentially the individual having fever and all of their symptoms. And then once it goes from that little teal part to the grayish blue part, that's when their fever ends and their symptoms are getting better. And so they spend that 24 hours recovering. And then once those 24 hours are done, they can go about their normal activities with the caveat that they should be taking added precautions. Once those 5 days are over, they can go about their normal day. In our second example, we have an individual with fever, but no other symptoms. So we have, again, the fever duration varies. We wait 24 hours. Then we can go about normal activities with added precautions. In example 3, we have an individual with fever and other symptoms. But in this example, the fever is ending, but the other symptoms take longer to improve. So as you can see in that teal bit, the fever ends like 3/4 of the way through, but the individual waits until the symptoms are actually getting better to begin that 24-hour period of staying home, and then being able to go about their normal activities. And in our final example, we have an individual who shows symptoms, gets better, but then develops a fever. So we can see that person is sick, they're staying home, their symptoms get better, they wait the 24 hours, and then they go about their normal activities taking added precautions. However, they then develop a fever, so they have to then return back home. Then once the fever ends, then they wait the 24 hours again, and then they can continue going about their normal activities again, the normal precautions caveat. Next slide, please. So next we're going to talk about conjunctivitis, and I'm going to go through just a couple common illnesses that you'll see in schools. So we're going to talk about conjunctivitis next. This is pink eye. So some common symptoms include watering, irritation, and eye redness, swelling of the eyelids, crusting on the lashes, sensitivity to light, and discharge from the eyes. This can be spread person to person, mostly in the form of droplets. The way to prevent it is going to be good hygiene, good hand hygiene, and washing surfaces. As always, we're going to, for all of these morbidities, we're going to recommend that the child is evaluated and tested by a healthcare provider, because they're going to also be able to provide further guidance and potentially treatment depending on whatever sickness they have. A child is also able to return to school once the symptoms subside or treatment is initiated and maintained for at least 24 hours. And that's going to go hand in hand with seeing a healthcare provider. Next slide, please. Next, we have hand, foot, and mouth disease. Some of the common symptoms are fever and sore throat, but the most common that you'll see are going to be blisters or sores that occur around the mouth, and then a rash on the hands and feet, hence where it gets its name. It's spread person to person via droplets or via objects that an infected individual comes into contact with. And that's why when I say for preventing spread, hand washing, disinfecting, and avoiding close contact is incredibly important. This is something that we see a lot in daycare centers. What will happen is we'll have one child that is positive. They'll be playing with their toys. They'll put their hands in their mouths. It'll spread very easily. And then it can potentially spread to other kids who are also in the daycare that way. Children can return to school if they have no fever and if they're feeling well enough to participate in normal activity. And then another important bit of this is that they have no uncontrolled drooling. And you'll mostly see this in, again, the youngest kids, but this sort of goes back to it spreading via droplets or objects that the infected individual comes into contact with. And if a kid is drooling a lot, it's going to be hard for them to not come into contact with, toys and desks and chairs and all sorts of stuff that kids are going to be touching in a daycare. Next slide, please. Next, we have varicella. This is chickenpox. So some of the symptoms include fever, tiredness, and a headache. And then obviously the classic symptom of a rash with itchy fluid-filled blisters, which eventually become scabs. This is spread person to person via contact with the fluid from the blisters. The fluid can also aerosolize, so you're going to want to make sure that anybody who's showing symptoms are isolated and sent home as quickly as possible. The most effective prevention for chickenpox is going to be vaccination every single time. Children may return to school after the rash has entirely dried and crusted over. And this is going to be because the fluid is really the most infectious part of it. So once the rash is dried, it's less likely or not likely that they're going to actually be able to transmit from themselves to another child. Next slide, please. And then I think this is our last what to do slide, but we have unknown GI illness. And this covers a number of different things, but they all share very common symptoms. And these include stomach cramps, diarrhea, vomiting, nausea, and fever. And it is spread via the consumption of contaminated food or water, but can also be spread from person to person. It is possible to get different GI viruses by using the same bathroom as somebody who is positive. So this is one of the reasons why it's really important that everybody washes their hands after they use the bathroom. And teachers and school staff are trying to keep the bathrooms as clean as possible. The best way to prevent spread are going to be hand washing and disinfecting surfaces. And the child may return to school when the diarrhea and vomiting have resolved and they can hold food down. Now, this time may extend if an outbreak is declared, but in individual cases, this will be what the guidance will be. So let's talk about planning for outbreaks, epidemics, and pandemics. So it's important to have an emergency operations plan or an EOP with an infectious disease section. So we do have training available, and if you stay tuned for the end of the presentation, there will be more information provided in regards to that. But preemptively, you can consider how you want to implement different public health interventions. And these include screening, testing, contact tracing, distancing, and other appropriate mitigation measures. And there's a decent amount. You can actually click on that link later to read more about that. Next slide. Perfect. Oh, we missed one. Wait, go back one. My mistake. I'm sorry. So we'll talk about minimizing transmission in elevated illness activities. So like I mentioned at the beginning, oftentimes we are unable to prevent initial cases of a disease and need to take steps to minimize further transmission. So first thing that you can do is ensure that reportable diseases and outbreaks are appropriately reported. And if you click on the link that's in that second bullet, it'll bring up a list from the Arizona Department of Health Services of all the reportable conditions that are in Arizona. And then on the right, we can see different strategies that are recommended as part of an outbreak response. And these include illness monitoring and reporting, managing exposure and testing, increasing distance and cohorting, and respiratory protection. So, first thing, illness monitoring and reporting. So it's important to be able to recognize common symptoms of respiratory viruses and other pathogens that commonly appear in school settings, because this can help to prevent increased spread. If a teacher or faculty member notices that a child is sick and is able to get them to the nurse or isolated quickly, then you can help prevent the spread to other children. You can also provide parents and caregivers with instructions on how to monitor students for illness and when to have them stay home. You can also establish procedures for allowing them to return to a school setting based on the disease of concern. And having these procedures set preemptively is really important because it'll prevent additional questions coming up on a case-by-case basis when they eventually do come in. So being able to have those answers right away is going to help you just streamline this whole process really, really well. So next we have communicable disease reporting. So for reportable diseases, admins of schools, child care establishments, and shelters are required to report any disease that falls on the communicable disease reporting list. The reporting timeframe does vary based on the condition and the situation, but you can find the information for every single reportable disease as far as the timeframe on what needs to be reported and when in that Arizona, the AZDHS reportable disease list. That being said, the reporting for most conditions or outbreaks should be done within 24 hours by telephone to the Pima County Health Department. And we do have phone response lines available 24 hours a day. There's also a nice app at the bottom called Healthy Kids AZ, which is a free app for school nurses, health aides, and childcare staff that provides additional reporting. Additional information and includes information on reporting. You can also find contact information for the Pima County Health Department on there, as well as the health department for other counties as well, if for whatever reason you needed to contact them. This is just a screenshot of some of the communicable diseases that needs to be reported by schools. It is important that you review the ADHS School Outbreak Threshold Guide for the outbreak definitions for the 4-starred conditions there. And those are conjunctivitis, diarrhea, nausea, or vomiting, which is going to be your unknown GIs, scabies, and strep A infection. Next, we have managing exposures and testing. So one thing that you can do proactively that'll help a lot will be to identify spaces to separate sick students from well students while waiting for them to leave the school. Ideal spaces will obviously allow for staff to monitor the student while having a door that separates the space. Whether this is in a nurse's office or the front office, having a space that's designated for this can help a lot. Schools can also notify caregivers of exposures to communicable diseases. Again, just increasing that communication pathway between the school and the family can help a lot. And then once again, if you have a reportable disease, ensure you notify the Pima County Health Department so that we can investigate. Additionally, during outbreaks or a pandemic, and when disease-specific tests are available, testing programs may be implemented to help prevent the spread of disease. Next, we have respiratory protection. So we should absolutely support anyone who chooses to wear a mask or a respirator, regardless of illness spread levels. Different masks do offer different levels of respiratory protection based on their classification and manufacturing quality. And if you click on that link, you can find a list of all sorts of masks that are available in the United States, who produces them, and how effective they are at protecting you from all sorts of different stuff. Wearing masks may help prevent those who are most at risk for severe illness from respiratory diseases and decrease the spread of illness in school. Next, we have distancing and cohorting. So there is a difference between the two. Physical distancing is a way to increase space between people in settings where there is commonly close contact. So obviously classrooms, lunchrooms, schools in general are going to be places where there is commonly close contact. So doing what you can in the event that there is elevated illness levels to increase the space between students can help to prevent the spread of disease. Cohorting is something that involves creating groups of students or people that are separated from other groups or other cohorts. And then each group or cohort is kept together with the same peers and staff to reduce the risk for illness. These two practices, distancing and cohorting, are two plans that are best put into place ahead of time before increased transmission of illness takes place. Because let's say that they're in the event of an outbreak, say there's a respiratory virus going around, you want to, have an idea of where everyone's going to be prior to people actually getting sick, because these are measures that are going to help prevent additional spread. And then the final couple of slides, we have some considerations for prioritizing additional strategies. These include the pathogen of concern and the level of impact on community and community members, the age of the population, students with disabilities, at-risk populations, and availability of resources. So the scale of your response will very often change based on the pathogen that you're dealing with. I will say that one of the best ways to stay informed is to connect with the Pima County Health Department to stay up to date on the latest data on disease spread. We have now started updating our respiratory website with information on COVID, flu, and RSV on a weekly basis, which shows both case counts and hospital admissions. So you can get some nice up-to-date information on that. You can also attend our monthly virtual Pima County Health Department school health update calls. They are currently, we're off for the summer for them, but they do resume on August 7th, and they run from 1 o'clock to 2 o'clock p.m. And if you're interested, you can contact school support at pima.gov to be added. And then finally, be informed on the impact to local healthcare and hospital systems. Understanding the potential burden that different pathogens can have on your local hospitals and healthcare systems can help you to stay informed, again, on the severity of different pathogens that can potentially present themselves in a community. Next, we have for considerations are the age of the population. So in many situations that you will be serving, the population is going to consist mainly of young children, especially in school settings. So for young children, we find that layered protection strategies are often the most effective. So apologies. Consider barriers that children would have with normal approaches, especially with, very, very young children. Again, kids like to touch their mouth, like to touch their faces. They like to touch all sorts of stuff. So being, the teacher in the classroom and just taking steps to wipe up after them, opening windows, improving air filtration, all of these things can be additional strategies layered on top of each other to help protect populations that aren't necessarily able to protect themselves super well. Next, we have students with disabilities. So federal disability law requires individualized approaches for working with youth with disabilities. Reasonable modifications or accommodations when necessary must be provided to ensure equal access to in-person learning for students with disabilities. So consider, again, additional prevention strategies, which we've discussed in the previous slides, to accommodate the health and safety of students with disabilities. And you can actually incorporate these strategies into individual plans preemptively, which can help in the event of increased pathogen spread. And again, I say preemptively because having these plans built ahead of time is oftentimes going to be really effective as far as allowing you to put it into action as quickly as possible. Next, we have individuals at increased risk. This is going to be mostly immunocompromised individuals. So an individual who is immunocompromised is at risk of getting very sick with certain illnesses, or has family members who are at risk of getting very sick as well. So again, we would encourage prevention strategies even in times where there is not elevated pathogen activity. Again, prevention is going to be one of your best approaches to handling any sort of elevated pathogen activity in a school setting. And finally, we have the availability of resources. So the availability of resources, PPE, testing, can vary based on location and other factors. So you should try to prioritize strategies for responding to outbreaks based on the available resources that you have. Focus on select at-risk sites within a school, and make sure that you partner with the Pima County Health Department to ensure that you have the most up-to-date public health information, as well as access to resources provided.
All right, thank you, Jake. That was a lot of really wonderful information, and you did a wonderful job communicating that. I'm going to now move us over to Alex from our FEP team. You have the floor.
Welcome, everybody. My name is Alex Faulkner, and I'm the Partnerships Program Coordinator here with Public Health Emergency Preparedness. In conjunction with what Jake has just presented, our division felt that it was important that we add a couple training resources for as far as developing these emergency operations plans. So on the first slide that you see here, both of these trainings are going to be from the same organization. They're both from Train Arizona, or you can find them at train.org. Train is a national learning network powered by the Public Health Foundation, and it's also affiliated with the Arizona Department of Health Services. And so these are just really good training resources, rather. Sorry. The two trainings that I'm about to reference are part of a larger series on developing school emergency operations plans, but these are the two specifically that we thought would go well with the rest of the material presented here. The first one is all about COOP plan, which we love acronyms in public health. COOP is continued performance of essential functions, and that's just under a broad range of circumstances. So this training is really just about developing an annex within your emergency operations plan to plan for a bunch of different contingencies so that you can continue up the day-to-day operations pretty much no matter what the situations is. And as you can see on the slide, this is all sort of developed on the recommendations of the six-step planning process in the guide for developing quality school emergency operations plans, which, to anyone who doesn't know, that guide was developed and issued jointly by the U.S. Departments of Homeland Security, Department of Justice, Department of Education, and the Departments of Health and Human Services, just as a resource for the schools. Next slide, please. And so this other one is just more based on what Jake was saying in the earlier slides. This one is more geared towards planning for infectious diseases. As you can see here, it's just developing another annex. So just, another section in the playbook for how to plan and prepare for these infectious disease outbreaks if and when they should happen. Again, both of these courses are self-paced. The link is there within the slide once you receive the slide decks. So more than welcome to peruse those at your leisure, as well as the other modules within the course. It's all really, really good stuff, but these two modules in particular are the ones that we felt very pertinent to the rest of the subject matter that we're discussing. That's really all I have for you. I'm going to pass it back over. Thank you so much.
Thank you. All right, so we're coming towards the end of this presentation today. As a reminder, we just want to thank all of our school partners for continuing to engage with Pima County Health Department. It is so critical, as we know, over the last 4 years, how important it is for us to have a strong relationship to ensure the health of your school, student and staff communities, that we're ensuring that all families can be as healthy as possible. So if ever you are confused about which part of Pima County Health Department that you should reach out to, we try to keep it very easy. So we have our Youth and School Communities team, and you can reach out to us Monday through Friday, either by email or phone. Email is here, schoolsupport@pima.gov. It's monitored regularly by our team of school health liaisons. We do have our school support phone line, 520-724-7018. And our primary goal is to just say we have a huge health system with a lot of resources. And if ever you are, like most school nurses I know, dealing with 5 issues at once, and you don't have time to figure out who the best subject matter expert is, we are here to hold your hand and make sure that we get you to the correct party, whether that's our EPI team, our community health and food safety team, and so on. So please do reach out to us. We are of service to you. And then finally, you'll see that we have a number of additional resources here from Pima County Health Department, the Center for Disease Control and Prevention, as well as the Arizona Department of Health Services. And now I would like to open up for any questions from those attending today. All right. Seeing no questions, again, I want to thank you for this continued partnership. Pima County Health Department is committed to ensuring you have all the resources possible to be as healthy as possible in your school communities. So thank you for your time today, and have a wonderful rest of your Thursday.